Hi, Dr. Henry. I'm just wondering, with the decision to still allow the outdoor social gatherings, are you confident that is not a source of transmission, and that it's mostly the indoor social gatherings? And can you give some examples, even for the restaurant industry, for example? Have we seen a high number of transmissions, and can you give us some examples of that?
Sure. So, we need to find that balance, and this is something we've been trying to do, and there are some areas where we are seeing transmission events. They're not when we're outdoors, when we're maintaining our distance, when we're being safe. And we've said that from the very beginning. We know that this virus, as we've learned, doesn't transmit as well when we're outside. It doesn't last as well outside, and we can protect each other by having that distance between us outside. So those are the things we need to focus on now, how we do that and do that safely, whether it's going for a picnic in the park, if we are out in our own backyard, making sure that we're not crowding a whole bunch of people under a small tent. We've seen some of those things. Those are not safe activities. Safe activities are when we're spread out, we're enjoying each other's company, but from that distance, and having that same small group of people, so we're not exposing many others. And what we are seeing, and yes, it's not all restaurants by any means. Most of them are doing a really good job, but I am hearing more and more, and we've had the support of many in the Restaurant and Beverage Association, the understanding in the last few weeks in particular that there's a lot of frustration, especially among younger people, about the restrictions and the restrictions on social connections. And with March break and universities being out of session for a while, we're seeing that lead to augmentation of transmission through places like restaurants and bars and pubs. And it's unfortunate, but right now that indoor setting is where we're seeing it most transmission happening. So, we've talked about what happened with the pub that had the event in Fraser Health, but we have many such examples. We did some targeted work-safe inspections in Whistler a couple of weeks ago. We found that it was very challenging for staff to manage groups of people later in the evening, and that was what was leading to transmission. Often people live together in common crowded housing, so some of the staff accommodations in Whistler, for example. But we're seeing that in places all around the province and mostly in the urban areas. So now's the time to give people a break, to step back from those indoor environments where we see this risk being greatest.